Good morning, and thank you for joining us today for the special presentation by Dr. Angela Laygo. In keeping with the UOG health needs, the community health needs, Dr. Charlene arranged this special opportunity for a presentation and a discussion of coping with the pandemic and the quarantine situation. So without further ado, Dr. Charlene will introduce the speaker today. Thank you.
Thank you, Dr. Selman. All right, today we have with us Dr. Angela Laygo, and she is a licensed clinical psychologist with over 8 years in the mental health field. She has a doctorate in clinical psychology from the American School of Professional Psychology. Dr. Laygo has experience in inpatient and outpatient settings, providing therapy and conducting psychological evaluations. She has worked with a wide range of mental health issues, such as anxiety and depression, as well as severe psychiatric disorders, including schizophrenia and bipolar disorder. Welcome, Dr. Laygo.
Thank you so much. And thank you all for taking time to be here. I realize that it's your break from the semester, and it's another meeting to attend. So thank you for taking some time out to be here, and I'll discuss some strategies, some ways that you can remain healthy during this pandemic. So, okay. So just a quick overview of the learning objectives. We'll talk about how the pandemic has affected people's mental health. We'll acknowledge emotions associated with the pandemic. We'll describe the physical and behavioral symptoms of COVID-related stress. We'll talk about the psychological and cognitive impacts of prolonged isolation or pandemic isolation. We'll talk about video conferencing and Zoom fatigue, as it has been termed. And then lastly, we'll discuss some strategies to increase our resiliency and improve our emotional well-being during the pandemic. Okay, so I would like to begin with a brief exercise. I'm going to read a script and I want you to follow along. You can close your eyes or keep them open. It's really up to you. Okay, so take a few slow, long breaths and relax. Place your hand on your stomach. Now slowly breathe in through your nose and then slowly exhale through your mouth. Feel your stomach rise and fall as you breathe. Imagine your belly filling up with air like a balloon as you breathe in, and then feel it deflate as you breathe out. Feel the breath moving in across your nostrils. And then feel your breath blowing out across your lips. As you breathe, notice the sensations in your body. Feel your lungs fill up with air. Notice the weight of your body resting on whatever you're sitting on. With each breath, notice how your body feels more and more relaxed. Now, as you continue to breathe, begin counting your breaths each time you exhale. You can count silently to yourself or aloud. Count each exhalation until you reach 4 and then begin counting 1 again. To begin, breathe in slowly through your nose and then exhale slowly through your mouth. Count 1. Again, breathe in slowly through your nose and slowly out through your mouth. Count 2. Again, breathing in slowly through your nose and then slowly exhale. Count 3. Last time, breathe in through your nose and out through your mouth. Count 4. Now begin counting at 1 again. When your mind begins to wander and you catch yourself thinking of something else, return your focus to counting your breaths. Try not to criticize yourself for getting distracted. Just keep taking slow breaths into your belly, in and out. Imagine filling up your belly with air like a balloon. Feel it rising with each inhalation and falling with each exhalation. Keep counting each breath, and with each exhale, feel your body relaxing deeper and deeper. Keep breathing and then slowly return your focus to the room you're in. So the exercise I had you do is a mindfulness exercise called mindful breathing. It is an exercise that we teach clients to help them stay focused in the present moment. Mindfulness is our ability to be fully present, aware of where we are and what we are doing, and not overly reactive or overwhelmed by what's going on around us. It's a focus on experiencing the moment. And these are short pauses that we can insert into our everyday life. As some of you may have noticed, it can be challenging. Achieving such a focus requires control of attention. So it may be difficult for some of us because our thoughts get in the way, and that's okay. As with anything, it requires practice. But mindfulness exercises helps us feel less stress, so we're able to think clearer. And this simple technique of breathing fully helps us relax and focus. Okay. So next, I'd like for us to acknowledge the reality that we are in. So all of you are working from home. You're working from home with your spouse or your partner. If you have children, you're working from home with children. Maybe there are other family members in the home, such as parents, in-laws, grandparents, and living in close confines without much break can create frustration. Or maybe you're living alone. Here on Guam, it's easy to assume or to think that everyone has someone or everyone lives with someone, and that's our collectivistic culture, but that's not the case, right? There are many people who live alone. And so similar with living in a full household, living alone presents its unique challenges during this time, especially with regards to social isolation, which we'll talk about in a bit. If you have school-aged children, you are now primarily responsible for their education. I have a 4-year-old son who's in pre-K, and his teacher the other day called us parents honorary teachers. So, you know, we're having to teach the material and make sure that they complete and submit assignments. So that's a, you know, can be an added stressor for parents. Maybe your spouse or your partner has lost their job as a result of the pandemic. Or maybe you know someone who has been financially affected because of the pandemic. Maybe you contracted coronavirus, or maybe you know someone who died that was a COVID-related death. So these are all our current realities. And we need to acknowledge and recognize the emotions that we are experiencing, whether that's anger, grief, loneliness, sadness, confusion, fear. These are all normal responses to stress. And in one way or another, we are all struggling, some more than others, but we are all experiencing challenges. So here on Guam, the number of COVID-related deaths continue to rise, right? As well as the number of positive cases. And this can create a lot of anxiety, panic, fear in the community. And this devastating pandemic has affected nearly every aspect of daily life. We see the effect is a multi-dimensional disruption of employment, finances, education, healthcare, food security, transportation, and even our religious practices. So the systems that we depend on, work, healthcare, education, economic systems, have all been destabilized as a result of the pandemic. Let's see. Okay. So we are in the middle of a collective grief. This includes the loss of our sense of self, our sense of predictability. We don't know what's going to happen in a few months. We don't know what's going to happen next week. There's a loss of control, feeling like I don't have control of what's going to happen to me or my loved ones. And a loss of the belief that we can protect our loved ones. So a loss of general safety. And these efforts to contain the virus and stop the spread, such as the stay-at-home orders, the social distancing, these have all changed the social fabric by which individuals, families, and communities, the way that we cope with tragedy. So here on Guam, how do we cope with the loss of a loved one? They usually have rosaries, right? We come together as a family, we come together as a community. And because of these stay-at-home orders, social distancing, we're not able to do that. We're not able to come together and grieve. And that can be challenging for a lot of people. The pandemic and the stay-at-home orders are things that none of us have experienced before. So our brain doesn't have data from past experiences that it can draw from to make informed decisions. There's a lot of uncertainty with this pandemic, and uncertainty is a major trigger of stress. So it weakens our brain's ability to deal with stress, priming it for anxiety when fear hits. And so anxiety arises when our prefrontal cortexes don't have enough information to accurately predict the future. And this is what we're seeing right now with COVID. So without accurate information, it's easy for our brains to spin stories of fear. And that goes back to that loss of predictability, you know. So the number at Guam Behavioral Health and Wellness Center, they have the crisis hotline. And the crisis hotline, the number of calls that they're receiving has increased dramatically since the pandemic began. And so this tells us that people are worried, people are concerned, and people are struggling emotionally. People are having a difficult time holding it together. Experts say that there is this second wave building, and that's the rising rates of mental health and substance use disorders. So the stress and disruption caused by the pandemic has heightened depression and anxiety globally. And it will probably be years before we see, you know, the real effect of the pandemic with regards to mental health. But current surveys are indicating that people are struggling mentally and emotionally with the pandemic. So the long-term impacts of the pandemic are not limited to those with pre-existing mental health issues. That there will be people, right, who will lose their marriages, lose their jobs, and struggle financially because of the pandemic. Okay. So just some physical and behavioral symptoms of COVID-related stress. So stress during an infectious disease outbreak can include some changes in sleep or eating patterns, difficulty concentrating, increased use of alcohol or other substances, hypervigilance, which is associated with anxiety, emotional numbness. So you just kind of have a flat affect. You don't get really happy anymore, and you also don't get really sad. You know, you're kind of numb to feeling anything. Easily frustrated, which can lead to anger issues, worsening of chronic health problems and mental health conditions, lack of interest and pleasure in daily activities, which goes back to that emotional numbness, poor sleep quality. So you might be sleeping longer, but not necessarily better. And then this lack of reward. So our life isn't very rewarding at the moment. We would normally have very active social lives, active employment. We're very busy. So as we move through our everyday lives, going to work, maybe meeting a friend for lunch or coffee or going to the movies, that all results in reward to us. and that increases dopamine, which is our reward chemical. But right now, there's nothing to reward us, which again goes back to those other stressors, such as numbness. So these are some behavioral, physical, and emotional stressors to be aware of as the pandemic continues. So I'd like to now talk about some of the ways in which the stay-at-home orders can affect us emotionally and cognitively. So since the pandemic began, we are now at home most of the day. And if we're living with others, we're home with them too. And if you live alone, then you're by yourself. So we have found ourselves isolated without choosing to be this way. And so confinement, loss of our usual routine, reduced social and physical contact with others, that can cause boredom, frustration, and this sense of isolation from others. Pandemic isolation can make us feel exhausted. It can give us a feeling of detachment from others. It can make us irritable and angry. And again, that feeling emotionally numb. For some people, they might experience deteriorating work performance or just a general reluctance to work. As a result of being quarantined, not only are we disconnected from the people we care about, we can't do the things that we normally would do, right, to relieve stress, such as meeting friends for lunch or coffee, going to the movies. So this then can trigger that loneliness or symptoms of depression. Isolation can also disrupt our sleep, either sleeping too much or difficulty sleeping. So as you can see, this pandemic isolation can lead to just poor overall health. So the pandemic isolation can also affect our cognitive functioning. We might be more forgetful than normal. Some may experience confusion. We might have difficulty planning or making decisions. So we're not the well-organized adults that we used to be. And this is because our executive function is affected. So when we're under prolonged stress and anxiety, we go into this very basic state of cognitive ability. All the very routine things that we do every day, those are going to be fine because they're biologically hardwired into us. But as soon as we need to do anything that requires higher order planning or thinking outside the box, we're going to find that a little more difficult because we need to use our frontal lobes for those sorts of tasks. So, and our brain is having a lot more difficulty accessing our prefrontal cortex, which is important when we're trying to make decisions. So this means that we're having trouble making good decisions, and we might also have trouble understanding other people's perspectives, which might explain an argument that maybe you had with someone in your household. Isolation can also affect our hippocampus, which is our memory center and helps us to understand where we are in space and time. And so we often hear people say they don't know what day it is, or the days just kind of seem to blend together. And that's our hippocampus being affected by this isolation. Cortisol. Having stress hormone like cortisol directly affects our brain cells. And high levels of cortisol stops the process of the brain from making new brain cells. So when we're not making these new brain cells constantly, then we're less cognitively flexible, which means that we're less able to adapt to new situations. Studies have also shown that this social isolation is associated with an increased risk of cognitive decline and dementia. And then for older adults, loneliness and the isolation is associated with reduced cognitive function. So when we talk about, in the strategies section, we'll talk about some of the ways, some things that we can do to kind of mitigate these consequences of the isolation. So as we can see, pandemic isolation can affect our emotional and cognitive functioning. And maybe some of you have experienced some of these since having to work from home. Maybe you find yourself more forgetful and easily confused. Maybe you notice that you're more easily frustrated and irritable. Maybe you find yourself having more arguments with other members in your house, or maybe you noticed that your work performance is suffering. And so we see that it's a combination of the stressors of the pandemic itself and having to isolate. So that can really amplify symptoms for some people. So because all of you are working from home, I'd like to talk about video conferencing and what has now been termed Zoom fatigue, which applies to other video platforms as well. It's not just to Zoom. So we're all using video calls more at work and in our personal lives, and we use it to connect with friends. Some use it to participate in fitness classes, attend events like weddings, graduations, funerals, and even worship services. But all this time on the screen can be exhausting. And overusing these virtual platforms of communication can make us tired and just burnt out. So why are online meetings more tiring than face-to-face ones? Well, for one, there's more emotional effort to appear interested. And what is the only way to show that we're paying attention? It's eye contact, right? And so it's sustained eye contact, and then there's an intense focus on words, and having to engage in this constant gaze can make us uncomfortable and can make us tired. Delays in responses. If there are delays in responses, that can negatively affect our interpersonal perceptions. So a study found that just 1.2 second delay in response could make people perceive you as less friendly. And because we're all over, right? We're all over the island. Of course, there's going to be delays in responses. And so those can also frustrate people. The nonverbal communication. So we miss out on a lot of nonverbal communication on video conferencing. On video chat, we work harder to process these nonverbal cues. And paying more attention to these consumes a lot of energy. It takes up a lot of conscious capacity. So it's increasing our cognitive load. And as we talked about earlier, how the pandemic and isolation can impact our cognitive functioning, right? We now have this added layer of video conferencing that just further stresses our cognitive capacity, and goes back to that just draining. And maybe after, I've heard a couple of colleagues say that after a session, they're just so tired, they're so drained. And that's because all this having to, like try to focus on the students, and maybe you're focusing on yourself, and it can get so tiring. In person, we're able to look around, right? We're able to look around, look at others in the room. On a video call, if we turn to look out the window, it seems like we're not paying attention, right? So that's also another drawback to these video conferencing. Most of us are also staring at a small window of ourselves, and that makes us hyper aware of our expressions and how that might be interpreted. So without the visual breaks of expression that we need to refocus, our brains grow fatigued. We might also feel anxious about our workspace, or worrying about, someone in your household making an appearance on your camera. Some of the other frustrations with regards to online teaching could be that the students are less inclined to participate. There might be a lack of student-to-student interaction, just feeling disconnected from the students and not being sure if the students are understanding the material. And so some of the physical consequences of online meetings can include the backache, headache, eye strain, just from being on the computer most of the day and then sitting down. Also in person, so let's say we're going to a meeting. In person, we often meet people like on the way to the meeting, so we could maybe catch up on issues or discuss some things before going into the meeting. And just the simple act of relocating to a different room can be energizing. But at home, we might just be working on something, right? And then we just get onto a Zoom meeting or without taking any breaks, right? There's no transition. There's no transition from what you're doing to another task. Another component of now having to work from home is you don't have a commute, right? And for some of us, the commute home is when we would decompress and sort of shed our identities, right? As we morphed into our social identities. So kind of I'm now putting on my home hat, right? And now, because you're working from home, there's no separation. There's no separation between work and home. So some of you because you're working from home, you might be working more or putting in longer hours. And so for some, home is not the sanctuary that it once was, right? You get up and you get ready and then walk to your little workspace and start working. There's no like transition with working from home now. Okay. Oh, I'm sorry. Okay. Managing Zoom fatigue. So what are some things that you can do to reduce fatigue? So if possible, try to limit the number of video meetings in a day. And if you can, use phone calls. Use phone calls to reduce eye strain. So not all meetings, right? Not all meetings have to be video meetings. And those multiple video meetings in one day tend to kind of blur into another, just like the days do. Try not to schedule back-to-back meetings. Like give your brain a chance to switch gears between meetings. Take a break away from the screen between meetings. So, get some fresh air, go for a quick walk, get some water. Avoid multitasking. Trying to do multiple things at once really cuts into our productivity. So when you're on a video meeting, try to close any open tabs or programs, put your phone away, try to stay present. And make sure that your home office feels different from your living area, even if it's the same space. It's important to try to create that boundary between work and home. If you have longer video meetings, take a mini break by minimizing your window or just looking away from your computer for a few seconds now and then, right? We can still listen without staring at the screen, but don't go and do something else, right? Use that to just let your eyes rest for a moment. And reduce on-screen stimuli. So using plain backgrounds, you can hide yourself from view. Those are some things that you can do to reduce that. Okay, so let's talk about some of the strategies to increase our resiliency and improve our emotional well-being. Well, first, it's important to acknowledge the uncertainty. So when we confront uncomfortable feelings and reassure ourselves, we feel more in control of our life. Recognize that all emotions are valid. As I said earlier, some of the feelings we could have as a result of the pandemic are anger, grief, and loneliness. And these are all normal reactions. It's okay. It's okay to not be okay. Regularly remind yourself what is important to you, right? What helps you find value in life and to be of value to others. What is resilience? Resilience is our capacity to respond to adversity and change. It's our ability to adapt to stressors, or basically our emotional elasticity. And we can increase our resiliency by building our social supports, focusing on positive emotions, and finding meaning in our experiences. Recognize that this is the situation and I'm doing the best I can with the information I have. We also have to be able to sit with some degree of uncertainty and ambiguity in order to continue our lives. And it can be uncomfortable to do that, but to remember and to keep in mind that that's part of the process. So it's been about 8 months since the pandemic began. Hopefully you all have been able to find your groove, hopefully you all have got into your routines. But if not, it would be helpful to follow a schedule. So having a schedule helps normalize our sleep and our eating habits, which will then lower anxiety over time. Solitude. It's important to set aside time for yourself, whether that's taking a walk alone or reading a book. Having some me time during the day is important. Staying physically active. So keeping busy, exercising, cleaning, cooking, baking. I know a lot of people have started their own gardens, and I think that's pretty cool, but just staying active, staying busy, and spending time outdoors. For myself, with my 2 kids, we actually take them out more. We go to the beach more. So being outdoors is always important. So build your social support. Don't completely isolate yourself from others. Prioritize your relationships. Keep up social interactions using FaceTime, phone calls, texts. And practice mindfulness and relaxation exercises like the one that we did in the beginning. Mindfulness helps us to stay in the present moment. Find purpose or help others. So how can you support others during this time? Maybe it's a quick call or text to check in with them, to see how they're doing. That's a form of support. Maybe you know someone who is struggling at the moment, not only with the pandemic, but other stressors in their lives. So giving them a quick call and letting them know, hey, I'm here for you. Let me know if there's anything that I can help you with. Call upon your thinking brain. These are basically, embrace healthy thoughts. And why would this be important? So, well, our thoughts, our feelings, and our behaviors are all related. So keeping things in perspective is going to help us as we move forward with the pandemic. Coping thoughts are reminders of how strong we've been in the past. It helps us tolerate distressing situations. So a coping thought might be, my feelings make me uncomfortable right now, but I can accept them, right? So recognizing that it's uncomfortable to be angry, or it's uncomfortable to have these feelings of fear, but I can accept those. I can accept that. Another coping thought might be, I've been through other painful experiences. And I'll kind of address that in a bit. Focus what is in your control. I don't have control of other people's behaviors, but I do have control of my behavior and how I react to other people's behaviors. So we all have experienced challenging situations in the past, right? We've managed to cope with a lot in our lives. So we need to remind ourselves of that. What did I do to cope? How did I get through that? What did I learn from it? We've handled adversity before, and it's important to remember to remind ourselves that we recovered. Embrace time to develop your relationships. So the members in your household, using this time to develop, right, to connect with them. And if you live alone, then using this time to connect with others, friends or family that are not with you. It would also help us to find gratitude in where we're at, appreciating the moment. And that can be very challenging right now. But it goes back to that thinking brain or those coping thoughts. Create purposeful activities. So what I mean by purposeful activities, that can be taking an online class or any like distance education activities. So the American Psychological Association, APA, they usually have their annual conference and because every year, and because of the pandemic, they have it online now. And so they have all their sessions, all their poster sessions, it's all on this on-demand library. And here on Guam, right, if I wanted to attend the APA conference, I would have to pay the airfare just to go over there. And that's really expensive. But right now it's online, and I can use those as my continuing education credits. But like activities like that maintains our brain health. And it's also, it keeps us up to date on what's happening in our field. Try to limit social media and news media. So information is helpful, but too much information can be unhealthy. And limit news intake to what is actually providing new information, and stick to reliable news sources. I don't know how many times I've gotten like on the WhatsApp, people will share news, and then later on you find out that it's fake news. So try to stick to those reliable news sources. Okay, sleep hygiene. So some tips for sleep: maintain regular bedtime and waking time. Try to avoid sleeping in, and get up at the same time each day, even if you feel like you didn't get a restful night of sleep. Try to avoid naps, especially if you have trouble falling asleep at night. And associate the bedroom with relaxing. Try not to do any work in your bedroom. Avoid watching the clock. So if you have difficulty falling asleep, maybe get up for a little bit and do some like light reading. But try not to just lay there and watch the clock. If you live alone, try to stay connected to people through phone calls or video chats. Keep to your regular routines and schedules. Find creative ways to keep in touch with others, like looking at a virtual museum together, sharing a cup of coffee over video, or even like they have online games that you can play, that you can play together. I wanted to briefly address working from home. Try to set up discrete workspaces for you and others, with the understanding that when you're in your workspace, you are working. So if you have small kids, then try to create shifts where one partner takes care of the children while you're working. If you must work in your bedroom, don't work on your bed. The bed should only be for sleep and intimacy. Okay, try not to work on your bed. Working in bed has the potential to disrupt our sleep. So try to stay away from that. And then talking to children and teens about coronavirus. So maybe you have kids or nieces or nephews who might have some questions. So try to help them understand basic information about what the coronavirus is. It's important to use developmentally appropriate explanations tailored to the child's age, their verbal ability, and their cognitive understanding. And maintain calm. So how we say things, right? How we say things is just as important as the actual words that we use. Be factual and give clear explanations of the situation. Try not to overload or bring up issues that they don't ask about. So just trying to be direct, honest, and brief. So I wanted to open the discussion and kind of hear from some of you about how you are staying healthy at home. So how are you connecting with others? Maybe you started a new hobby, or how are you staying healthy at home? I didn't know how we wanted to do this, if people wanted to unmute, or I'm not sure.
Dr. Laygo,
Yeah.
I have a comment or question. If you don't mind, I even wrote it down. So maybe you can help me with this or help me fix my thinking. I think I stress myself out by working at home because I feel like I need to work quicker.
Mm-hmm.
I need to work flaking because I'm working from home. And so I always feel like I got to do things quicker, faster, longer. Is that clear?
Yeah. So is it feeling like there's a sense of urgency?
Yes. There's always a sense of urgency for everything almost, I think, that pops up in my email.
Mm-hmm.
Inbox or what free up and respond.
Oh, I'm sorry, I can't hear you.
Oh, shoot. Okay, my internet is unstable. How about now?
Okay, yes.
Okay. I feel like I have to work quicker all the time and faster and get to things within a specific time frame. And I really stress myself out, I think, with that way of thinking.
Mhm. Did you have that before the pandemic, before working from home? Or is that something new?
It seems exacerbated for some reason.
So having this sense of urgency, what do you think would happen if you, I guess, what are you expecting to happen if you don't get to all these tasks at the moment?
I don't like making people wait.
Hmm. What would that mean about you if you made people wait?
That I'm slacking.
Mm-hmm. Yeah. Yeah. I think back to, and I'm going to, I have another slide. I have one more slide to talk about, but going back to it's okay, right? This is the situation, and that I'm doing the best that I can at the moment, right? I need to take care of myself in order to take care of others. And if that means that I'm going to respond to this person tomorrow or later in the day, then that's okay. I think what might help or benefit is also prioritizing for the day those tasks that do have a deadline. Trying to prioritize, and that can be hard, right? Because we might think that everything is a priority, like everything needs to be done now, today. And if not, if I don't do this, I'm going to be seen as I'm slacking. I'm not doing my work, right? But no, that means that I have other things more important that I need to attend to. And these other things, yes, they're important, but they're not as important at this moment. And reminding ourselves that I will get to that. It doesn't mean that I'm a horrible employee or anything. It just means that this is the situation. These are my priorities right now. I will get to this. I will eventually get to these other things. But, this is important, and I'm important, and my family is important. And so let's say you have a deadline, and maybe a family member is sick, and they need you to take care of them. Then that goes back, right, to priorities. And for a lot of people, it's going to be our family. right? Because work is going to be there. But this is priority. This is my family. That's priority. And if I miss this deadline, then what's the worst thing that's going to happen? Are you really going to get fired? Are you, what's the worst thing that can happen? So maybe it goes back to keeping things in perspective, right? So trying to prioritize what's important right now at this moment, and meeting those, and then getting to other things that might not be as important. Does that help? Does that make sense?
Andrea Santos, if I could comment too, because that's something that I struggle with as well. And I know one of the things, I really appreciate a lot of like the normalizing context that you provided. But I think that, like another thing that we could pay attention to is expectations of women, and Dr. Santos Bamba, maybe you might identify with this. I think especially being at home, there's lots of expectations for women that, and mothers, especially, that you're here. And so you should be able to provide all of the things that mothers provide. And also, the fact that there is, you brought it up, like the lack of separation between work and home, is, and that we're in a pandemic. So the expectation is we are always near our computer. We're always near our computer, and that expectation then means that I should always be able to produce, and I should always be able to respond. And I really like what you were talking about, which is that we need to help create, and even Dr. Salman brought it up in the beginning, that schedules for ourselves and honor those schedules. I think that we weren't making excuses before, but we had really legitimate reasons, because we were in meetings, physical meetings. We were physically in front of our students. We were physically at home. And so we were making dinner, and that was different than before. And so we had not excuses, but we had very legitimate experiences to go, no, I'm away from my computer, and we allowed ourselves that time. And, I have difficulty allowing myself that time, but I'm trying to, I'm definitely trying to.
Absolutely.
Thanks.
Yeah, no, you brought up some great points. And it's going to go back to actually putting in that effort and being more intentional on creating that separation between home and work. Like you said, you're there in front of your computer's there, you're on your phone, you have your phone, so you can also respond on your phone. So yeah, that goes back to that sense of urgency. But yes, you're going to have to be intentional on creating those boundaries, and intentional on knowing your limits and being able to just step away from work. And that's going to be difficult, right? That's going to be really challenging for some people. But at this time, in this pandemic and the situation that we're in, that's going to help maintain your health, and also be productive, for your family too. Because if you're just work, what's happening with the family. So being more intentional on creating those boundaries between, okay, now I'm working, and now I'm not working. So yeah, I appreciate you bringing that up.
I wanted to add something to, so one of the things that, Dr. Charlene was saying is kind of something that I experienced with the pandemic and just being, a faculty, is that I think there's so much pressure to, because somebody used the word over responsibility with me. Rita, you're being over responsible, and that really hit me, and I kind of like sat with that for a little bit, because I think with the pandemic and sort of being, an instructor to these students, you have this sense of over responsibility. Like, I'm a leader, I need to be a leader, I need to show everyone that I'm doing great and that I'm functional, so that I can sort of pass that down onto all these other people that I'm training and educating. I think one of the things that I really feel myself is that, like, just on an airplane, they tell us to put on the oxygen mask on ourselves first, before we can care for other people, or put the mask on others. Why? Because we're going to be dead if we don't take care of ourselves. And so trying to prioritize self-care, which may mean saying no to some things, is sometimes okay. I mean, there's so many sayings, right? Like those, and they all make sense now. Like, you can't drive a car without gas, so you got to fuel yourself up. You can't pour from an empty cup. We can't serve others and be effective in serving others, whether it's taking care of our students, or trainees, or parents, or children, or spouses. We can be effective leaders if we're falling apart, and if it means to take time to address those things for ourselves, or not responding to emails right away, or prioritizing, like you said. And sometimes people may criticize us, but as long as we're giving our 100% every day, then we got to be okay with that, right?
Right.
Yeah, it's been hard for sure.
Yeah. Yeah, you brought up some great points, especially the part about having to take care of ourselves before we can take care of others. And that's where that self-care, taking time for yourself, and like you said, saying no to things is going to be helpful. Thank you for sharing. I have one more slide, and then I guess after this slide, then we can, if there's any questions or any other comments. But I just wanted to address, or to go through this. What is our life going to look like after the pandemic? So some questions that we might have after the pandemic are, what will normal life look like? We've already seen so many businesses close their doors, right? How long will it take for the economy to recover? When will schools open? When will we return to our offices? The pandemic will leave some people questioning whether the world is still a safe place, right? It's this continued uncertainty. It's filled with uncertainty right now. And even our values and our habits might change. But it's important to remember that shared experiences of stress can bring communities together. So we're all trying to do the right thing for each other. Use this experience to guide your future challenges and struggles. So we're going to continue to experience tragedy and hardships years after this pandemic. Whether it's the loss of a loved one or managing a medical issue, use this experience to kind of support and guide you and others during those times. Many of us have not seen our friends or family since the pandemic began. So as we transition to our new normal, it's going to be important to rebuild those relationships. So process your experience together, support one another, try to rebuild those bonds. Reflect on your experience. From this experience, what positive changes could you make as you move forward? Make a list of new habits that you'd like to possibly embrace. And just a couple takeaways, final notes is we're highly resilient, right? People have survived pandemics. And while it can be stressful as the pandemic, as this pandemic unfolds, we will find the strength to adapt, to recover, and to heal. Give yourself some grace. And what I mean by grace is being patient and being kind to yourself. And this was when Dr. Charlene had mentioned her struggle. This is what I was thinking of, was that give yourself some grace, right? We're in this pandemic, we're struggling, and a lot of us are not okay. And that's okay, right? This is a temporary state, right? Continually remind ourselves that this is a temporary state, and find meaning. And that can be especially challenging right now, right? We're in the middle of a pandemic, and this person is telling me to find meaning. That's really hard. But maybe in a few years, maybe in 5 years, you can look back on this experience. And maybe from this pandemic, maybe you made a life, a change in your life based on your experience of this pandemic. Try to find meaning. Look for those silver linings. And again, it's going to be hard to do that right now. But it's something to keep in mind as we transition into life, or our new realities, life after COVID. So that was the end. I wanted to know if, I think we have some time for questions or comments or.
Thank you, Dr. Laygo. Yes, we do have some time. If anyone has a comment or question, I can check out the chat real quick. But if you do have a question, please go ahead and ask.
Oh, yes.
Unmute yourself and ask.
I was going to answer her question because she had asked what did we do to stay healthy at home. So one day my mother told me she was walking 2.5 miles a day. And then I realized, that's a little hint there. And so whether it's before 6 o'clock, I turn it off and I go put in my 6,000 steps.
Awesome. Yep.
And,
were you doing that before the pandemic?
It was more like 1.25 miles. It's more like 3,000 steps.
Mm-hmm.
Yeah.
That's awesome. Yeah.
And that hobby thing. So on a bad day, I look back on my hobby and say, wow, look at what you did that weekend. My hobby is writing papers and book reviews. So my productivity in book reviewing, has gone through the roof.
But that's great. That's maintaining our brain health, right? And it keeps us busy. It keeps us cognitively active. That's good. Mm-hmm. Anyone else? How are you staying active, or how are you connecting with others? So for myself and my family, during this pandemic, we started, so I have family, you know, all over the States. And we started video chatting, and it's funny. And one day, you know, I had made the comment that it took a pandemic. It took a pandemic for us to do this. You know, I mean, we would keep in contact by like text messages, things like that, but not actual phone calls, and not this video chatting. And it's like, it took a pandemic for us to do this, right? Maybe that's part of that silver lining, you know, bringing families together.
Well, can you hear me? Yes. One thing that we're doing, I really miss my extended family. I don't know about everyone, but I have a huge family, right? And so my sisters and I decided that since we can't do Sunday dinners very often with extended family, that we were going to do a quarantine Halloween celebration. And it's going to be via Zoom. And so we're connecting with our extended families from across the island, my first cousins, right, and their kids. And we're doing a Halloween costume contest and a pumpkin carving contest. And all of it is going to be done virtually. It takes some planning, of course, but that was one way for us, I think, just to feel like we're connected and to show that, yeah, we miss everyone, and we're just waiting for this pandemic to be over. But in the meantime, we want to continue to nurture our relationships.
Yes. I like that idea. Yeah. That Zoom Halloween. That's awesome. Yeah. And you're absolutely right. Yep. Keeping up with those social supports, and building, you know, just maintaining our relationships with others. Yeah. I like how some people are, for like birthdays, they'll have like these drive by, or you drive, you know, drive over to their homes and wish them happy birthday. I think that's another great thing to do. I like how people are, it seems like a lot of people are making effort to maintain those relations and those contacts and the social support. I really like that people have found creative ways to do that. Yeah, I think that goes back to that being resilient, right? Being resilient and having that strength to be able to do that.